Today, we're speaking with Dr. Cynthia Kudji Sylvester, who is a UMHS graduate, and her daughter, Dr. Jasmine Kudji. And why don't you both just please start off by introducing yourselves and just letting people know about your amazing story of matching at the same time at the same hospital into the LSU Health Systems. I know, Cynthia, you're in family medicine. Jasmine, you're in general surgery, but you're both in the same hospital system. And what has the experience been like for the two of you since 2020 when you were on the Today Show, NBC Nightly News, profiled in People magazine? You were just everywhere. Just what have you been up to since then, and what was that whole experience like?
Oh, so well, our story pretty much began with when I went back to Ghana and when I went there, it was just an amazing experience, life-changing experience.
Right.
Knew when I came back that I wanted to do medicine, but of course, Jasmine was coming along the way by the time, I think when I was like 21, 22 years old.
Right.
When I was at UMHS, I found out that Jasmine had got accepted into LSU, and we were like insanely just like, oh my God, this is crazy. And we ended up school together, and then we ended up matching at LSU together. And then Jasmine actually ended up changing from surgery into pediatrics.
Oh,
And
wow.
yeah. So that's one of the big changes since residency. It's been crazy, I guess would be the word to say.
Yeah.
Very busy, huh, Jazz?
Yeah, for sure. It's been a whirlwind. I think anyone would probably describe residency that way. It's a lot going on at one time. For me in particular, like my mom said, I switched from general surgery to pediatrics. I had originally wanted to do pediatric surgery, which is about a 9 to 10 year journey. And surgery, the lifestyle is a little different from what I see myself doing in the future or wanting in the future. And I realized that I like the kids more than I like the surgery. So yes, I made that switch, and it's honestly been one of the best things ever. Pediatrics is so fulfilling, and it's so happy, and I just love it so much.
And which hospital are you working at, Jasmine?
So I'm now at Tulane.
Okay.
So I'm no longer under the LSU system for the first time in my whole life.
All right. Okay.
I've been LSU Tiger since undergrad, but I'm now part of the Green Wave.
Okay. Another great place to be, Tulane.
For sure, for sure. I really do enjoy it.
Okay. And Cynthia, you're still at the same hospital?
Yes. I'm still doing LSU family medicine. It is very busy. As a family medicine resident, you're doing everything. We're delivering babies. You're in surgery for 1 month. And then after that, that's about as much surgery as we get, about 1 month rotation. And then after that, you're in the ER, you're in the clinic. So you get a lot of experience as a family medicine resident.
Great. That's awesome. And can you just tell us a little bit how you both got to be included in Gutsy on Apple Plus TV? That's really exciting, and we'd love to know more about that.
Yeah, that just kind of came out of the blue. They reached out to us on social media.
Wow.
And at first we didn't know what it was, because of course it was very secretive, But once we, talked to them, we realized what the show was, who the show was for. We were just like, oh, wow, this is a once in a lifetime opportunity. We just were so excited to be a part of it.
Yeah, absolutely. Absolutely. I tell you, one thing that was so interesting is when we actually did the shoot, they had the Secret Service there. We were like,
wow.
Yeah. We were like, this is wild. Like, you are a real Secret Service person.
Right. And this show is with Hillary and Chelsea Clinton, and I know there's a lot of celebrities and also a lot of just inspiring women in general. So that must be really exciting. And how did it make you feel to both be included in a show like this, like Gutsy? And what are some of the qualities that you both think makes a woman a gutsy woman?
So it was absolutely such an honor to be included among such great women. I mean, they have such a myriad of individuals who have done so amazing, so many amazing things that, you know, we're truly just honored. Working with Hillary and Chelsea Clinton, one of the things that they wanted to do was put us in an arena that we had never done. And so they chose to work with bees. And I was like,
Oh, that's funny.
but definitely a great experience. I think one of the things that being a gutsy woman, one of the greatest characteristics is just having a lot of resilience.
Sure.
Being in UMHS, you know, you have tough courses, you know, you got to get through them. You got to be resilient enough to get through them. And even if you fail, you know, try again and keep trying and keep doing it. And it's the same thing when you get to residency. And to be honest, it's the same thing in life. You know, our roads are not going to be the same, and it's okay.
Sure.
You know, have to get there 1, 2, 3. You can get there, you know, 1 and then 7 and back to 1 and then, you know, up to 10 or whatever, you know, as long as you get there and as long as you stay focused.
Yeah.
Great.
You know, and I would say the same thing. I think another quality that makes a woman gutsy is just trying something that's new, you know,
Sure.
trying something that, you know, you don't think you can do, and just proving it to yourself and proving it to others that, you know, it's possible for you, and not only for you, but for others to obtain as well. And I think that's what the show really shows the most is, you know, there are so many women out here doing so many incredible things that you wouldn't even imagine. You know, like when we went to the premiere for the show, we actually met a woman who she's climbed all of the largest mountains in the world.
Wow.
And if you were to look at her, just look at her, she's a regular woman, you know, she's 5'5" maybe, you know, she's not super buff or anything, but she is absolutely incredible. And I mean, it just goes to show that if you set your mind to do anything, you can really achieve it.
No, that's amazing. One of the things I'm going to ask you a little bit about the premiere party later, but what's one of the things that surprised you about working with both Hillary and Chelsea Clinton? Something that really surprised you about them?
They're just, you know, very nice people.
Great.
You know, you think that with everything that they've been through and that,
Sure.
you know, that they might have an air, but to be honest, they're very easy to talk to. And I remember at the end of it, my daughter was like, "Mom, you just had a conversation with Hillary Clinton," and she was like, "You can talk to anybody."
Yeah, I think that's like the most incredible thing about them is that they are normal human beings, you know, like they are so personable and so kind, and like they genuinely wanted to get to know us, which to us was like, you want to get to know us? Like
Wow.
you want to know us? Like it was just unbelievable. Like we couldn't even process it, you know. And I think another thing that just goes to show like how, you know, down to earth they truly are, you know, when we you know, went to the premiere, we watched the episode, and after Bill Clinton was there.
Wow.
And you know, of course we're like kind of starstruck. We're like, oh gosh, like wow, you know, we wanted to go say hello, but we were like, can we go say hello? There's Secret Service surrounding him, you know, what should we do? And finally we're like, you know what, let's just go up, try to say hi. And you know, I think I approached Hillary and I said hello, and she like immediately recognized us. And you know, my mom was like, can we say hello to Bill? And she was like, oh, of course, you know, and just immediately just brought him over. And even he was like, oh, you know, so nice to meet y'all. Like, I mean, everyone was just so kind, you know, there was no air, you know, there was nothing strange about it, you know, and it was so nice to see and to feel.
That's great. And I know I saw some pictures of the premiere party and it looked like you had some nice red carpet moments, some fabulous outfits. And just tell me a little bit about, did you get to meet, other than the Clintons, did you get to meet a lot of celebrities as well?
Not really, to be honest. Not really. Yeah, it was really just them.
Okay. All right, no problem. Yeah, and they are definitely big celebrities to meet for sure. So I'm sure that must have been really amazing to see the premiere in New York, and just You guys so deserve it. And, you know, your daughter, your story of being a mother and daughter matching into the same hospital system went viral all over the world. And we touched a little bit about this earlier, but you mentioned, Jasmine, what life has been for you like that time starting residency. I mean, you got all this global media coverage, and then you both had to go and start residency, and that must have been really intense in the beginning, I can imagine, for both of you. What are your thoughts on that?
Definitely. I think, well, LSU, when I first began, I think they were trying to welcome us.
Yeah.
They had our names and pictures like plastered all over it. All over their like internet. Like if you couldn't turn on a computer without seeing our faces. And
of course.
But at the same time, it was very difficult because you're starting off, you're an intern.
Yeah.
Here you are plastered all over everywhere. It's kind of like, okay, the pressure is on.
Oh, yeah.
Yeah, for sure. And I think, you know, a lot of intern year, you just kind of want to get in, put your head down and, you know, do your best. And I do remember that moment of, you know, I was in surgery at the time. And I think I started on trauma. And, you know, we would meet at like 4:30 in the morning to review the cases or, you know, review the surgeries for the day. And I just remember them turning the computer screen on and my mom and I's face popped up and I was like, oh gosh, everyone's
yeah.
going to know that that's me. Like, this is so embarrassing. Oh my God. But the thing that I honestly found was the coolest about, you know, going into residency with this, you know, this media frenzy
Sure.
was that patients noticed us,
Wow.
you know, and especially like our African-American patients, especially women, you know, they would say, oh, you know, you're a part of the mother-daughter duo, you know, I'm so proud of you, you know, and on those days where you've worked 20 hours, you know, or you've made multiple mistakes and you're just feeling terrible, you know, it feels so good to have someone say, you know, I'm proud of you, like, keep going, you know, just, it really feels like we have the whole world support behind us. And it does make this journey so much better.
That's
Absolutely.
so awesome. So awesome. And that kind of goes into my next question. You guys are both are inspiration to, you know, young girls and women dreaming of one day becoming a doctor, especially women of color. What's one piece of advice that you would both give to young women of color who want to become a doctor and are thinking about it, but are maybe a little uncertain about whether it's possible for them? But what advice would you give them?
I think for me, one of the main things is that, you know, always realizing that the road is going to be tough, right?
Sure.
You're whatever color you are, it's going to be tough.
Sure.
And you have to accept failures. You know, you have to turn that inside out because
Sure.
are going to happen, but there are opportunities to get better. It's an opportunity to learn. It's and you will not realize it at the time, you know, but later you're going to really appreciate it. So even if you don't get into like the residency of your choice or you don't make, you know, straight A's, you know, take what you have, you know, and pat yourself on the back and keep going because somebody's going to recognize your efforts. Yeah.
Yeah, I
Sure.
completely agree with that. And I think, you know, something that also goes with that is this idea of being transparent. You know, we all go into medical school and a lot of us are like type A, you know, we're used to succeeding, we're used to, you know, making the grades and being the best and all that stuff. And then when you get to medical school, everyone is like that.
Yeah.
You know? So
Yeah.
all of a sudden you're no longer number one, you know, out of 200 people, you may be number 200, you know?
Sure.
And sometimes you have to look over to your peers and say, hey, I don't understand what's happening. You know, like, I don't understand this subject. I need help, you know, and sometimes it's so hard to do, you know, but transparency is, I think, key. It allows you to connect with the people around you. You know, it allows you to connect with your patients. You know, it allows you to be free. You know, it prevents you from bearing the weight of succeeding, you know, or failing on your own.
Absolutely. And Jasmine, I remember you telling me when we initially did the interview 2 years ago that you and your mother would both study together via FaceTime and Skype, even though your mother was in Louisiana, well, you were in Louisiana rather, and she was in St. Kitts. And what was it like being able to support each other together this way, even virtually? It must have been great knowing that you had each other's backs.
Oh yeah, definitely. I mean, we still do it to this day. I mean, it's mostly out of necessity, you know.
Yeah,
Because at the end of the day, like I said, you need support, you know, and for me to have that support be my mom, you know, that's just unparalleled. Like it's been the best thing ever. And I think at that time, you know, when she was in the islands and I was here, you know, I was still very young. I think I went to med school at 21. And so, you know, I needed that support to just kind of get through life,
sure.
you know?
Mhm. Yeah.
Absolutely.
And to be honest, I mean, we still are very, very supportive of one another, you know. And it's the same thing when you're in medical school. A lot of times, you know, if you don't support one another, you're not going to make it through. You know,
Of
medical
course.
school thinks it's very competitive. Yeah, sure. But you want to be nice to each other. You know, you want to support one another. You want to, you know, it's not, you can be a gunner, you know, but be a nice gunner. You know what I'm saying? Because it's all about support. Because you're not just competing with the people in your class. For a residency spot. You're actually competing against everybody in the country. You know, so use the people that are around you, right, to support you and get you through it. You know.
Right. And Cynthia, you started UMHS as a non-traditional student, and wanted to ask you what advice you have for current and prospective non-traditional students, rather, for being successful in med school, especially for women of any age, just like you, that might have kids. Because I know we have a lot of women that are non-traditional students, and sometimes they have little kids that they bring to the island. What's some advice you would give them?
That, you know what, your children are going to get sick and it's okay.
Okay.
Things are going to happen and it's okay. You're going to get through it. A lot of times, just being a non-traditional student, you got to utilize the resources that UMH has available. One of them are your attendings. That's one of the things that kind of stands out about UMHS, is that their attendings are so accessible. You know, I remember meeting with an attending on a Sunday morning, you know, because that was the only time in my schedule, but they met with me. So you got to utilize your attendings. You got to utilize your dean. One of the things that struck me about UMHS is that how they were able to change the schedule to fit my needs if I needed it.
Sure.
And so you got to utilize those resources and know that, you know, yes, we bear the responsibility of being a mom, but you can absolutely do this, and UMHS helps make it possible.
Great, great. And that kind of segues right into my next question, Cynthia. Can you think of one or two things about your UMHS medical education that really helped you become the doctor that you are today?
I would definitely say the support of the staff. They were just absolutely amazing. I love the way they taught, because they broke it down for you. You know, they made things simple to understand, and then we also had study groups where, you know, you could go and you can be tutored by your peers. So they just give you the support that you need.
Right. Great. And Jasmine and Cynthia, you've really been an awesome interview. Is there anything else that you want to add about the show Gutsy, or about med school, or anything that we haven't covered?
No, I hope y'all all check out the show. We are on episode 8, I believe. But all the episodes, I've watched most of them already, and they've all been great. So
Yeah, absolutely,
Great.
absolutely.
And so people can binge watch you. It's several episodes, correct?
it is several episodes. Yes.
Great. And that's on Apple TV, Apple Plus.
Yes.
Apple.
Okay, great. All right. Well, I want to thank you so much for your time, and you've been a great interview, and I hope you continue to inspire, you know, many people, which I'm sure you will. And thanks so much for your time today.
Thank you. Thank
Thank
you for
you.